Dr. Tarang Krishna, I think one of the grouses of every person who's ever had to see a doctor would be that it's become very, very tricky if you fall sick when you don't have enough money to cover for your treatment.
So there are two things. First, if actually I would say there are two kinds of people in India. A, who are being sponsored by a corporate, where their insurance are being funded by that corporate agencies, and they have to just show in their insurance card, they go to a hospital and get their treatment done. Then there is another India who have money, but they do not have an insurance. They have not taken the wisdom of getting insurance done. They have the money, but what they do is they go to a hospital, pay cash, and get the treatment done. Now, when you say affordable, the way GDP is rising, the way things are rising, the way things are being introduced, India, I love what Upasana ji said is, why should we call that India is having a cheap treatment? वो cheapness, वो छोटा सोचना, वो कम सोचना, अपने आप को inferior दिखाना, I think that has to go away with healthcare. Healthcare is all about the best of technologies. Talent is costly. Cheap talent is something which can be dangerous for any hospital healthcare. Likewise, if you have to have the best of doctors in a hospital, you need to pay them good so that you get the best of talent for your hospital, right? And if they're suggesting any treatment to any of the patients, I mean, I would say free can be dangerous, cheap can be dangerous for a patient, right? Second thing is, if there are two kinds of...
the need, can one of you please switch off your mics, please? I don't think the conversation... Okay, I don't think the conversation is about making it cheap so much as making it affordable. I think it's important that we draw a line between the two. We are hoping that a majority of Indians should be able to get the necessary health checkups, healthcare. Their needs should be met without having to pay out of their pockets and without it having to burn a hole in their pockets. So I understand that there is a firm distinction between the two.
So Shweta, what is happening is people are actually investing in healthcare once they have been sick, when they've been diagnosed as sick. Problem is that they're not investing when they are well. They're not getting their regular checkups done. Had they been doing their regular checkups, probably what you're talking about is affordable healthcare. What you're talking about is getting their treatments done, and which is costly in a hospital. That is costly in a hospital because, see, I'm into cancer treatment. And when patients come to us, most of them are in stage 4. And in stage 4, where the disease is already spread to liver, lungs, bones, and brain. And then you expect that they should get that primary health treatment which is affordable to a patient, where the disease is already spread? No. I'm sorry, that cannot be possible.